Infection control processes. Infection control processes. So infection control processes, it can be grouped into two categories, standard precautions and transmission-based precautions. When infection control processes, you can understand from where we have to use the standard precaution and from where we have to use the transmission-based precautions. So before appointment, there should be preparedness, planned scheduling of appointments and triage consultation in place in the organization. Okay, that's a physical structure that will be coming into play here. Then upon arrival, when the patient arrives before treatment, evaluation of the patient should be done. Pre and perioperative procedures which will be done here. Okay, and during treatment, standard precautions or transmission based precautions should be carried out by the healthcare professional. So this will be the setup of places, and in this area the environmental cleaning and disinfection will take place. Okay, and then you will be followed with standard and transmission based precautions. So types of precautions, standard precautions, it must be applied to all patients at all the times, regardless of their diagnosis and infectious status. These are designed to reduce the risk of transmission of microorganisms from both recognized and unrecognized sources of infection. You have to assume everyone, all the patients you're treating, may be carrying some or the other kind of infection. Transmission-based precautions, these are specific to the mode of transmission. There are three main modes of transmission: airborne, droplet, and contact. And specific precautions are required to prevent or interrupt the transmission of pathogen of microorganisms within the hospital. You're targeting a specific pathogen which transmits through a specific route of transmission. Okay, you're trying to prevent that particular pathogen from spreading out. Okay, so that's the difference. So in standard precautions, there are some guidelines, universal rules of standard precautions. Consider all patients potentially infectious. Consider all blood, body fluids, and tissues to be potentially infectious. Consider all unsterile needles and sharp to be similarly contaminated. Okay, so these work practices are essential to provide a high level of protection to patients and healthcare workers and visitors. So these precautions shall be implemented when contact with any of the following is anticipated. When you know when you're going to do a procedure in which there will be blood spillage, there may be body fluid spillage, there may be an wound you are going to do the dressing. Okay, mucous membrane is open, you can access the mucous membrane directly. So in all these areas, the standard precautions has to be followed. So standard precautions include washing hands before and all the after patient treatment or specific contact. Handle the blood of all the patients as potentially infectious. Wear gloves for potential contact with blood or body fluids. You're going to do a procedure where you know there may be blood sprayed upon or blood spillage. Okay, or you may be in contact with the body fluids. You should wear gloves. Prevent needle stick and sharp injuries. And wear personal protective equipment (PPE) while handling the blood, body fluids, etc. Cap, goggles, mask, gown, gloves, foot cover, okay, and face shield. These all are the examples of different personal protective equipment. Handle all the linen soiled with blood and other body secretions as potentially infectious. Process all the laboratory specimens as potentially infectious. Wear mask for TB and other contagious respiratory infections. Correctly process instruments and patient care equipment. Proper sterilization and disinfection and cleaning should be done as per the guidelines for each and every patient care instruments. Maintain environmental cleanliness and manage spills as per protocol. Each blood spill, mercury spill, or any body fluid spill has their own protocols, which the hospital may have in place already that has to be followed. Follow proper waste disposal practices. Okay, so these are the precaution summary in images. Perform hand hygiene before and after every patient contact. Use personal protective equipments when risk of body fluid exposure is there. Clean and reprocess shared patient equipment. What are the general patient equipments which may be again used for other patients? It has to be sterilized and clean for the next use. Follow respiratory hygiene and cough etiquette. Wearing mask, covering your mouth while coughing, etc. Use of use and dispose of sharps safely to prevent any needle stick injury. Use aseptic technique, using PPE while doing the wound drainage or wound dressing, etc. Perform routine environmental cleaning, handle the dispose of waste, and use linen safely. And transmission-based precautions. Route of transmission are contact, airborne, and droplet. When contact transmission will transmit like from a person to person touching the infected patient or touching the articles or instruments used by the infected patients. Droplet transmission is through coughing and sneezing, and airborne transmission is again through coughing and sneezing, but it will travel through a longer distance. And infection by direct or indirect contact. Okay, it occurs through direct contact between the source of the infection and the recipient, or indirectly through the contaminated objects. So this is a situation of direct contact. You are directly touching the infected patient and you get infected. And the other thing is the patient is using objects, okay, which is again used by someone else. So this is indirect contact and this is direct contact. Management of patients with contact transmission. Place the patient in the examination room. Okay. Perform hand hygiene before and after touching the patient. By all you have to do, you have to wear the gloves before touching the patient. Use PPE like gloves and gown. Clean and disinfect the examination room accordingly as the patient leaves the examination room. Separate bathroom for the patients with suspected diarrhea should be provided so that they don't infect other at-risk patients. Single room, preferably if it is available, or otherwise you can cohort all the contact transmission-based patients in one room. Limit the movement and transport of patients who carry contact transmission, infected pathogens, etc. Dedicated patient care equipment for single patient should be there. Try not to reuse the patient care equipments which you have used on a infectious patient. So infection by airborne transmission, it occurs by respiratory route. Okay, with the agent present in the aerosols, droplet nuclei, etc. Infectious particles less than 5 mu in diameter. Okay, so it will not it will travel a long distance because you can see the infectious particles is less than 5 mu meter in diameter of evaporated droplets or dust particles containing the microorganism. It will remain suspended in the air for a long time. Okay, so that is the case in which isolation room and isolation policies come into play. And these droplets are dispersed widely by air currents, and it is inhaled by unsusceptible hosts in the same room, or even if they are not in the same room, some in a distance. Still, if the air currents carrying the microorganisms pass through them, they may also get infected. So airborne infections are tuberculosis, measles, chickenpox, and disseminated herpes virus, etc. Okay, so these are the examples of airborne transmission. So here you can see airborne transmission. The particle is less than 5 mu in diameter. So you can see if it was a little bit larger droplet particle, it would have fallen somewhere very near to the patient, infectious patient. But when it comes to airborne transmission, when the droplet particles is less than 5 mu meter, you can see the distance traveled by the droplet. So this is the difference between droplet and airborne transmission. So management by patients with airborne transmission, respiratory protection has to be followed. N95 or N97 mask should be used. Surgical mask should be used. If N95 or N97 is not available, then non-immune or pregnant staff should avoid taking care of the patients with airborne transmission. Persons immune to varicella and rubella do not require mask if they are coming in contact with the patients affected with varicella and rubella. Okay. Management of patients with airborne transmission, done gloves, goggles, gowns, etc. If spraying of respiratory fluid is anticipated, for example, if you are doing suctioning of the mucous membrane, okay, or you are doing ventilation, like you are inserting laryngoscope and everything, in such cases, you can expect the respiratory fluids to spray beyond the patient's area. Okay, so in that case, done gloves, gowns, and goggles. Perform hand hygiene, obviously, before and after treatment or any procedure. Instruct the patient to wear the mask while exiting the examination room, and teach them to practice respiratory hygiene and cough etiquettes, etc. You can also stick the posters of cough etiquette and respiratory hygiene near the respiratory examination rooms, etc. So that the patients can read and be aware. And clean and disinfect the examination room accordingly. Room should be vacant for an hour after the patient leaves. So, and specific precautions of airborne transmission, separate entrance to the facility should be given so that there is not intermixing between the airborne infectious patient and other patients. Airborne isolation room, if it is possible, the physical structure can be made into the hospital. Transfer patients to facilities that manage especially airborne cases. If you do not have isolation room or airborne infection isolation room, negative pressure rooms should be there to admit such patients. Self-closing door, so that if somebody forgets and leaves the door open also, it is not an issue. The door should close by its own, preventing the cross-contamination. Ventilation and exhaust fan should be there. Doors and windows should always remain closed and limit the movement and transport of patients within the hospital. Infection by droplet transmission occurs through large particles, droplets which is more than 5 mu in size. Droplets generated from the infected patients are propelled to a short distance. It falls very near to the patient's area. Applies to patients with respiratory viruses, influenza, adenovirus, pneumovirus, etc. Okay, Bordetella pertussis, Neisseria meningitidis, Streptococcus infection. Okay, so these are few examples of droplet transmission. So remember this 5 mu, the droplet size is more than 5 mu. That's why it is heavy and falls very near to the patient's area, within 2 meters of the patient. Infection by droplet transmission. So you can again see the same image, how different it is. The droplets which is greater than 5 mu and to 10 mu in diameter. The respiratory droplets fall very near, within 1 or 1.5 meter of the patient, infectious patient. But airborne, if it was airborne, it would remain suspended and it will move along with the air currents. So managing the patients with droplet transmission. Prioritize the patient with excessive cough or sputum production, provide face mask, and separate these patients from other patients. Do not mix them in the waiting area. Done mask, gloves, gown, or goggles. If spraying of respiratory fluid is anticipated, always perform hand hygiene. Instruct the patient to wear mask while exiting the examination room. Practice respiratory hygiene and cough etiquette. Clean and disinfect the examination room. It is almost similar to airborne transmission. The management is similar. Specific precautions for droplet transmission. Single room, if preferable. Wear mask while working within 3 feet of the patient. Spacing between the bed should be at least 1 to 2 meters, because you know the droplets is very near. 1 to 1.5 meter is always, it is spread near the patient. Limit the patient movement and transport. Dedicated use of patient care equipment to a single patient. Do not, if you are again planning to reuse the equipment or instrument for another patient, make sure it is properly